I think the worst feeling for a human, whether you want to have a child or you've had children, would be to find out that you have a diseased or sick child. Today I want to talk about a disease called cystic fibrosis. The last few weeks I've spent delving into nursing textbooks, websites that are medically related, medical encyclopedias, just to learn about this debilitating disease. And I want to spread that knowledge, the signs and symptoms, and whatever treatments are available to help raise awareness about this disease. Honestly, a few weeks ago I had no idea even anything about cystic fibrosis, what it was. I'm not even aware of anybody that had it. According to Medical Surgical Nursing, which is a textbook you guys are all probably familiar with, cystic fibrosis is a disease that affects the lining of the respiratory, gastrointestinal, and reproductive tracts. Basically, it affects the lungs, digestive system, and sometimes even the reproductive system. It's an inherited disease, which means it can get passed from generation to generation. A lot of times the parents won't even know that they have it. It takes both parents to be a carrier in order for that to get passed on to the child. It affects the secretory glands, which the secretory glands make mucus and sweat, which according to the National Heart and Lung Institute, that's all of the glands that help, of course, with the bowel movement by allowing liquid to help everything pass through, and then of course we know why we sweat. KidsHealth.org makes it clear that cystic fibrosis disrupts the balance of salt and water, so that is so essential to maintain that equilibrium. There's a thin coating of fluid that is in all of those systems. It pretty much is along the lining. I mean, we've described almost every system there is, and it disrupts that salt balance. And what that does is it affects most often the lungs and the pancreas. The mucus becomes thick, sticky, and hard to pass or dislodge due to this. In fact, cystic fibrosis has many signs and symptoms. It includes infection, a chronic cough, even a collapsed lung, which, according to the textbook of Medical Surgical Nursing, because there's not enough O2 in the body, it can even cause clubbing, which I wasn't aware of what clubbing was until recently, and it's actually the rounded parts of the fingers and the toes. The nails become rounded. The American Heritage Dictionary defines clubbing as a condition affecting the fingers and toes where extremities are broadened and nails are shiny and abnormally curved, as highlighted in the picture here with the curve. Instead of flat-looking fingernails that we have, or we're fortunate enough to have, cystic fibrosis causes this. Growth even and development can even be affected by cystic fibrosis. An individual with cystic fibrosis experiences delays or stunted growth, which is what the Adam Medical Dictionary states, and it also says that proper weight gain is almost impossible with this disease. Unfortunately, the worst part, cystic fibrosis, treatment is limited, which, of course, is really sad when you're dealing with children, and that's who it most often affects, because it starts from birth. Children and adults with cystic fibrosis have very little treatment options because this disease has no cure. The respiratory therapy is the most common treatment option available, a method which includes the Hoff cough, which the Hoff cough is an exhalation that expels most of the air from the lungs. It derives that name from its sound, is a Hoff cough, because you're getting rid of that and you're trying to break that off. The Medical Surgical Nursing textbook states that the Hoff cough can be effective to clear the airways of mucus. So when it's sometimes that extra sticky from the cystic fibrosis, it becomes even more, as gross sounding as it is, effective in order to help, basically to help you breathe. I mean, to get the oxygen down to the parts that need it. Alternate options for treatment include medicines or medications, immunizations to prevent respiratory infections. In fact, a yearly flu shot, which is a really common thing, is vital for somebody with cystic fibrosis because it can help limit those infections. It can help fight off the infections. If they had the flu, of course, it's even harder to fight off and break up the mucus, because you can get thicker mucus because of that. And antibiotics can also help lessen the effects of cystic fibrosis. Not all of this is doom and gloom, as average life expectancy has increased greatly for those with cystic fibrosis. As the treatments and awareness becomes more prevalent, it allows a healthier lifestyle for those affected by it. In fact, now we have an average median age of about 38, whereas just 50 years ago, the average median age for somebody with cystic fibrosis was 10 years old. So that is a huge turnaround in just the last 50 years of just what awareness can do to help treat this disease. It is a life-threatening illness, and unfortunately, there is not a cure. But like I said, we have more than tripled the average life expectancy. Things to remember are, if caught early, quality and span of life can be greatly improved, which the National Lung and Heart Institute also states that when treated at a younger age, you can achieve more than just the median age. And the point of all of this is to inform everybody participating in the cystic fibrosis walk about the cause which they are walking for. And by explaining the seriousness of this disease, they'll understand why the fundraising is so crucial and it goes to such a very important cause.